focused on macrophage activation via TLR4 CD14, leading to TNF release, fever, and hypotension, with detailed explanations on why other options are incorrect. Question 1. A 72-year-old man is admitted to the ICU with sepsis due to Escherichia coli. He becomes febrile and hypotensive despite aggressive fluid resuscitation. Which of the following best describes the mechanism responsible for this patient's symptoms? A. Superantigen-mediated T-cell activation. B. Toxin-mediated ADP ribosylation of G proteins. C. Activation of TLR4 CD14 on macrophages by lipid A. D. Inhibition of protein synthesis by 6DS ribosomal subunit cleavage. E. Autoimmune antibody-mediated complement activation. Correct answer. C. Activation of TLR4 on macrophages by lipid A. Explanation. Endotoxin, lipid A from gram-negative bacteria like Toc E. coli, binds to TLR4 on macrophages, stimulating release of pro-inflammatory cytokines, including TNF, which leads to fever and hypotension, hallmarks of septic shock. A. Superantigens, e.g. from S. aureus, cause toxic shock, not classic endotoxin-mediated sepsis. ADP ribosylation, e.g. by cholera or diphtheria toxin, disrupts host signaling but is exotoxin-related. D. 60S ribosome cleavage, e.g. Shiga toxin, causes cytotoxicity, not systemic hypotension. E. Complement activation plays a role in inflammation but not the primary cause of TNF surge here. Question 2. A 55-year-old woman develops fever and hypotension after surgery. Blood cultures grow Klebsiella pneumoniae. Which cytokine released after endotoxin recognition by innate immune receptors is most responsible for the patient's hypotension? A. IL-1B, IL-6C, TNF-I, D. IFN-GAN. TNF-I. Explanation. TNF released from macrophages after endotoxin binds TLR4 CD14 causes vasodilation, increased vascular permeability, and hypotension central to septic shock. A. IL-1 contributes to fever but is not the main driver of hypotension. B. IL-6 is involved in acute phase response but not primarily hypotension. D. IL-10 is anti-inflammatory and counter-regulatory. E. IFN-GAN activates macrophages but doesn't drive early hypotension in sepsis. Would you like questions?